The NHS Constitution was published in January 2009. It came out of the original work done for the Next Stage Review as part of Lord Darcy's review of the NHS. What the Constitution covers is the principles and the values and the purpose and the rights and responsibilities of the NHS.
And it's important because I think it sets a framework for which the NHS can be held to account, not only by the public but also by the people who work with us.
The whole framework is about values, excellence, quality of care, patients and the public having their say and staff having their say.
We had extensive discussions around the NHS, particularly with staff at the beginning, but we went on then to talk to patients and the public. And out of that grew a whole series of really important issues that people felt were the enduring elements of the NHS.
It talks about staff responsibilities, but also staff rights as well, in terms of, equity and fairness in the way in which they work. It demonstrates that staff have been listened to and they have been able to contribute to the Constitution.
The biggest resource in the NHS are the staff, so it makes absolute sense that they were able to contribute to it and that they continue to evolve and develop it.
It sets out some guidelines for the working relationship between patients, public and NHS staff in terms of how we all work together to ensure better health for the nation.
It's about clarifying roles for all staff and in terms of how we deliver the care, how the patients want their care delivered and how they can participate in their care.
I think it's a big opportunity for patients. It's the first time that everything's been laid out in one place in terms of what their rights are and what the commitment of the NHS is to them.
As a practicing GP within the NHS, I'm very, very pleased to see that within the NHS Constitution something's being put regarding patients' responsibilities.
We're going through extraordinary change in the NHS. Modernisation is happening at a very rapid rate, and the NHS Constitution will steer staff and patients in those changes.
The fact that it's written down and published means that the whole of the NHS is looking at the same framework and working within that. We're not working as individuals, but we're working as a service.
If all NHS organisations, including hospital settings and third sector organisations, have the same basic principles, it's got to be more efficient.
I think whenever you empower any group of individuals and they understand what their responsibilities are and what the opposite parties' and responsibilities are, it's going to clarify the situation.
The NHS Constitution brings together in one place the rights and responsibilities of the people who work within the NHS, both in terms of the way in which we expect staff to behave in terms of their relationship with our patients and our communities, but also the way the organisations that they work in and the system that they work in looks after and supports staff.
It's recognising us as something, an important part of the NHS really, and that staff need to be supported in doing training and in development, and obviously they're pledging to do that more and to support us to enable us to provide a better service.
When we talk about staff, it's an important point to make. We're talking about anyone who provides care to NHS-funded patients.
It's very clear in the NHS Constitution that the NHS values its staff, wants to ensure that staff have the necessary training and support to do their job.
The Constitution makes it quite clear that everyone has a duty of professional accountability. It's not just the organisation, it's about you as an individual. It talks about duty of respect as well there. I think that's just being fair and equitable, just trying to treat people in the right way.
It places a lot of emphasis on the importance of staff developing, and there's an expectation that staff will develop. And by doing that, they improve the whole service that we offer.
First and foremost, I think the NHS Constitution empowers the patient to identify that they're in control of their own health.
It'll definitely help to make sure that patients get equal access to services across the NHS.
There's a lot in there about quality and improving quality. We're committed to making sure that there is continuous improvement in services. That is going to be a real big bonus to patients.
What we've done is we've created a counterbalance to the rights and commitments we've made to the public. We've also said to the public that they've got some responsibilities too.
Patients are responsible for giving accurate information, patients are responsible for ensuring they have a GP and working in partnership with the healthcare providers to ensure they get what they need.
Patients have got a responsibility towards maintaining the system and especially turning up to their appointments, not wasting doctors' time or nurses' time. And the Constitution clearly defines the responsibilities of those patients.
I think the most important thing about the NHS Constitution is that it is owned by the staff, the patients and the public. It is all of our document. It's something that we can use to get absolutely the best for us out of the NHS.
It will be a living document and it will grow as the NHS grows, not only in terms of the quality of service, but of the ambition that the NHS would have for itself.
NHS staff will be pleased to see that there is this compass for the NHS.
I think it reinforces that NHS is there for you, it's owned by you, it's owned by the public, it's owned by all of us. It reinforces that it's not a them and us.
All round, it's a win-win for the patient, and it's certainly a big win-win for the NHS.
It is a huge opportunity to safeguard the future of the NHS, and we must take this opportunity.
There's no doubt in my mind that patients will read it and the public will read it as well, so it's very important that we understand what the principles and values and purpose, rights and responsibilities are. And then you should use that. You should use it in your daily work, with your relationship with patients. You should use it in terms of the relationship you have with your organisation and the people who employ you.